Hello students, welcome back. So today we are going to start new chapter, reproductive health. In our previous lecture, in previous chapter we have done about the reproduction system. So in this chapter we are going to start it how the reproduction should be healthy. This reproductive system should be healthy. Why? Because we people are the part of this nation. So here we have to contribute more and more. If we will be the healthy person, if we will be the physically, mentally, socially we are healthy, then we will contribute in a better way. So here same thing we have to start that what is reproductive health, what you understand about it. So it means that the normal functioning of the reproduction system. Fine. So here according to WHO, World Health Organization, they have defined this reproductive health as a total well-being in all aspects of reproduction. It means that a person or the couple should be healthy in all the aspects. And what are these aspects? Physical aspects, emotional aspects, behavioral as well as social. So what do you understand all these aspects? Physical means that all the organ system in the couple should be healthy. If it will be healthy, so what will happen? They will be happy or they will be satisfied. If they will be satisfied, so they will contribute in the proper way. And on the same way, if they are not fine, or maybe sometimes it happens that some couples are not able to give birth to their babies or the children. So what happens? In their minds they are not properly healthy. We can say that yes, they are not psychologically fit. So what is our duty towards them? That we have to make them stable. We have to make them understand that everything will be fine. So here we will talk about all these aspects. If if we can say as behavioral, same thing nowadays. What happens? So many cases are there, rape cases are there. So why it is happening? Because nowadays the people are not aware about these things, and this leads them towards the negative track. So here we have to make our nation, we have to make our country healthy in all the ways. Either it is a physical, emotional, behavioral or social. Then only we will be fine in every situation. Now for that one, before that, see here in 1951, India got freedom in 1947. So after that, what happened? They have analyzed the population of our country, the growth rate. So it was increasing. And on the same way, if we will see on the global level, they observed on the global level the population was increasing. So for that one, our nation, our country, India has initiated a program in the national level. So it is a very important question, who has initiated this planning program? Our country, India, has initiated this family program on the national basis. Fine. So this one is very important. What is it? Family planning on the national level. And when 1951. So what was the objective? What was the aim of the family planning program? It was that to check the growth rate, or to maintain the growth rate of the population. Fine. So they have done so many things. So after periodical assessment, changes has been done, and after some years, what happened? They have started another program with the same motive. It was the same thing as a family planning program, only they have changed their name as a RCH program. What is RCH program? Reproductive and Child Health Care Program. Again, this question is very important. What is full form of RCH? Fine. So our country has started this program RCH, and again, what was the aim of this RCH? Along with this population growth rate, we are considering about the health of the mother and the children. Both we are considering. So here what we are doing? We are maintaining the area for the mother as well as the babies. How? Because two terms are there. You must understand. What is that? Maternal mortality rate, which is known as MMR. Which is, what is it? Maternal mortality rate. And another one is infant mortality rate. Infant mortality rate. What does it mean? you have heard most of the time that in the earlier time what happens, there was a 12 to 10 12 children are there, fine. So out of them 10 to 12 children, what was happened that time, only 2 or 3 or 4 children get life, and all other children got dead. Why? Due to this mortality rate, because that time the mortality rate of the infants were more. And the same case, what is MMR? MMR is that rate in which we are considering about the maternal. Maternal means mother. The death of the mother during the pregnancy or after the after delivering, how many mothers are living or how many mothers get died. So this rate, check this thing. And what is infant mortality rate? That rate in which we are checking the infant. For example, the children who are very younger or below the age of up to one year age, we are considering due to the some problem, due to the facilities, as well as due to the malnutrition. What was happened that time, they get died. So here in this RCH program, along with the checking of the population rate, we are considering about the maternal mortality rate and the infant mortality rate. Why? Because we have to decrease both of these things. Yes, we are considering we have to decrease the population, but at the same time we have to consider about the health of the mother as well as their children, because if they will not if we will not consider about them, so it will not make our nation good. So it is required that we have to check both the things, and this RCH program is main focus towards these two things. Now how we will go through it, how we will check all these things. So we have to take some initiative of that. So how we can take initiative? We must have proper awareness. Awareness means we should know that how we can decrease the population and what are the programs the government has been initiating, and we have to aware about it. Along with this, proper facilities should be there. If facilities would be there, what will happen? The people can take more and more advantage. On the same time, equally the governmental and the non-governmental support must be there, so that the people can be take advantage of them in a definite pattern. Fine. So one by one I will discuss with you about awareness, how we can aware our coming generation, and how we will provide facilities and how we can support them. Fine. So we will start with the first one, awareness. Now awareness. How we can aware the people? We have to create the awareness among the people. Why? Because if they will be aware about the things, so they can understand it very easily. First thing I mentioned here, audio visual. Audio means which we can use by some listening thing, and visual with the help of any visualization which we can see it. So in television you have seen so many ads are there which are promoting that we have to check the population, what are the different methods by which we can adopt it. So all these things must be aware, and how we have to behave with the other persons. Fine. So these are some things which we have to follow, and we have to create awareness. Second thing, print media. In example, pamphlets. In pamphlets you can see so many things are written there related to what? Related to how we have to follow the hygiene, how we have to follow the how we have to see the population rate, how we can reduce it. So many things are there. So with the help of these methods, government and non-governmental agencies can take advantage of it and can create awareness among the people. Third thing, which what are the people which are involved in all these things are, they can be parents, okay, they can be your close friends, they can be your teachers. So all they can participate for the awareness. These people can make you understand that how you have to behave, how the things will go on. Fine. So these are the people which are involved for the awareness. Other thing, introduction of sex education in schools. This is very, very important nowadays. Why? Because see, as a child attains the age of puberty or in the adolescence age, what happens? There will be some distraction in their mind. Why? Because they think that why it is happening with us, why these changes are coming in us. So they become afraid of all these things. So this is a time to make them understand in a very good manner that these things are normal, and due to some hormonal changes it is happening with you, and you have to understand it. So that's why if you will not guide them in a proper way, what will happen? They will get frustrated, and due to this frustration they will get in a negative direction. So it is required for us, it's a duty for every senior people that we have to give proper education about the sex, because this is very common in our society, that if anybody talk about the sex, they are considering in a wrong way. But here we have to understand what it is really and how it is important for us, because we know that for human beings this reproduction is very, very important to continue the generation. So if we will not make them understand, so it will be difficult for them. Fine. So, along with this information about the reproductive organs, as I said that during the age of adolescence or that age, the people, there are so many curiosity in their mind. That time it is required that we have to inform them about their reproductive organs. For example, how the organs are getting changed, now the body is changing in what direction, and what we have to take initiative. For example, in case of female, proper sanitization is very important during the menstruation. So these are important things, we have to make them aware. Fine. If we will not make them aware, then they will not understand it and they will take it in a wrong way. At the same time, safe and hygiene sexual practices during this time, during the sexual intercourse, what are the things they have to follow? Here we are talking about some youth, because nowadays what happens, they are not understanding about these things. So it is required that to make them also understand that what practices they must follow it during. For example, they have to use condom. Why? Because another point I mentioned, STDs. What are these STDs? Sexual transmitted diseases. If they will not follow the proper practices, what will happen? Maybe the chances of these diseases, for example, that AIDS is one of them, which is non-curable. So it is required that they must aware about all these things. And other points, educating fertile couples, those in the marriageable age. What does it mean? That we have to educate those people, those are in the age of this fertility, those are in age of marriage. Why? Because if we will not make them understand, what will happen? Again, there will be some difficulty. How? We have to make them understand that if they are getting married, so they have to follow this hygiene, as well as they have to follow the some contraceptions, so that there will be a proper gap between the two children, and after two children they have to maintain that one only. So all these education we have to provide them. Along with this, we are focusing on the breastfeeding, prenatal care, postnatal care, how we have to take care of mother as well as take care of child. And as well as very important aspect for these days, that we have to give proper or equal opportunity for both fetus, male as well as female fetus, because what happens, this is the male dominating society, so people think that we have to go for the male child. So that time they are what practices they are following, they are going for the female fetus side. So here in this program, we have to make them aware that both the child, male as well as female, both are important for us, and we have to give equal right to them. Fine. As well as uncontrolled population growth. Now, if we are aware all about it, we have to aware that if they will not follow all these things, what will happen? There may be chances of increase in the population. If population will increase, what will happen? We know that we have limited resources. If we will not maintain, or we will not check the growth rate, what will happen? They will not take advantage of all the things, of all the resources. So it is the time to make them understand that the population growth should be maintained, or there should not be population explosion. Fine. Another point, sex abuse and sex related crime. See, this aspect is again very important, because if the people or the child or the children are not aware about all these things, what will happen? They will go in a wrong direction. And what they did, what they are doing some social abuse. For example, sex abuse. They don't know how to speak with the girls, how they don't know how to speak with the other, how can affect to the other person, and what are the crimes they are doing. For example, rape. All these things are happening in our society. Due to this, what happens? Our nation, our society become unhealthy. So for proper healthy society, what is required? It is required that we have to make them aware, all the people of our country, to go in the right direction. If they will be good, if they will think good, if they will follow good, what will happen? Ultimately, they will become a good citizen, and they will form a reproductive health, or they will provide a healthy society. Fine. So like this, we have covered about the awareness. So in the next one, what we will do? We will go for the another topic of another step. So now the facilities and the support which should be given by the government to the people which are in need. For example, I have written a pregnancy, during the delivery, during STDs, abortions, contraception. All these things require proper infrastructure, and this will be provided by the government, and they are giving to the people, as well as professional expertise. In rural areas, what happens? The delivery done by the women which are residing there, but it is required that the delivery should be done by the professional expertise. So we have to more aware, we have to give them facility. How the government is giving facility? They are giving proper conveyance, so that the person which are the lady which is pregnant, they are coming by the car which is given, or the ambulance given by the hospital, and everything after the delivery as well during the delivery, they are free of cost for them in the government. So they are focusing more towards the proper delivery or proper pregnancy of the women, as well as some material support after delivery. It is required that so many things required for the babies as well as for the mother, so that what will happen, mortality rate in the earlier times, why it was increased? Because the child was not getting proper nutrition. So after all these, what they are doing, they are assisting, they are giving support to the people, so that they will follow the proper health. And these are some things. During the pregnancy, it is required expertise required. During the delivery, same thing, professional expertise should be there. STD, what are these STDs? Sexual transmitted disease. During the time, what is required, that we have to give support to them. Why? Because if somebody is having these diseases, we should not treat them very harsh. We should be cooperative with them. So these are supports which should be given by the government as well as by the people. As well as abortion should be avoided. Fine. So we will discuss in the later sessions that why the people are going for the abortion. So sometimes it happens that couple doesn't want to continue the baby due to some their personal reasons. So that time it is required that what are the contraception they can adopt, or what contraceptives they are good for them. Fine. As well as some menstrual problems and infertility. During this time also, the government as well as the people have to give them support, so that they know about it. For example, some girls which are at the age of 12 to 13 years, they don't know more about these menstruation. So we have to give support to these one also. As well as infertility. Infertility is very curse for the women. Why? Because in the society, they are watching all these women in a negative way. So it is required that how we can help, how we can assist them by another techniques or by different method. So we have to give support to the expertise, so that they can find or they can do research for the new techniques. For example, in the next lecture, you will come to know that there are some aids. Fine. There are some techniques by which they, for example, IVF. So these are some important techniques by which what is possible. There will be possible that fertility rate can be lower down. So implementation of better techniques and new strategies. So as well as government should support to those researchers, so that they can find out new strategies for those people which are in need. Now another thing, statutory ban on the amniosynthesis. This is very important, amniosynthesis, from the examination point of view. First we will understand what is it, then we will discuss about that ban, why this is banned in India. Amniosynthesis is that technique by which we can detect the abnormality present on the chromosome, or we can say it's a prenatal technique. What does it mean? For example, in our previous lecture we have covered that if it is a uterus, inside the uterus baby is present here. So this baby is present inside some fluid, okay, and covered by some membrane, and this membrane is, inner membrane was known as amnion, and the fluid which is surrounding to the whole embryo, to the fetus, it is known as amniotic fluid. What is it? Amniotic fluid. So in this technique what they are doing, the expertise, they are taking fluid. Why? Because this fluid contains all the things, all the cells which is present in the fetus, and they are taking and they are observing, and after observing what they can detect, they can detect the chromosomal pattern. What they can detect? Chromosomal pattern. And what is chromosomal pattern? We know that this chromosome pattern is different in case of male fetus as well as in female fetus. Fine. How? For example, in case of female, XX pattern. In case of male, it is XY pattern. So how it is important for us? It is important because this technique is useful for detecting any abnormalities in any chromosome. It may be chances that chromosome can be short, it can be deleted, or something is added. Fine. So these are different chromosomal abnormalities which we will study in the next chapter. So here you have to understand that by this method we can detect those abnormalities. For example, syndrome, Turner syndrome, sickle cell anemia, all these problems we can detect in the fetus. So this method is, or this technique was important for that one. But after coming this technique, the people has taken it in a negative way, or they have misused it. How they have misused? They have used this method to detect the gender of the fetus. Okay, if they are getting any female fetus, what they were doing? They were going for the abortion, which was very harmful for the mother also, as well as for baby it's harmful, but it's harmful for the mother also. So that's why the government, what they have done, they have taken an initiative to ban this amniosynthesis, because it's not, what it is doing, it is decreasing the female birth rate, or we can say it is promoting the female feticide, and which we have to stop here. So this is the support which should be given by the government by taking such type of initiative to become a healthy environment, because in this society both male as well as female should be get equal rights. Fine. Along with these facilities, government, what they are doing, they are going for the child immunization. We know about the vaccination which they are providing. Immunization means in a proper interval, as the birth of the child, we are providing some vaccines to fight with the another diseases. So it is required that it should be given by the government, and we have to follow it. Another one is research to find out new methods or improve existing ones. So here one of the techniques adopted by the expertise of the amniosynthesis, but there is more need to research in that area. So we have to give support, we have to give facilities to these expertise to research more and more, so that there should be a more alternative of that one. And one of the important initiative taken by the CDRI. Again, the CDRI is very important from the examination point of view. What they have done, they have proposed, or they have manufactured Saheli contraceptives. What it is? This contraceptive is very important. Saheli, which was prepared by the CDRI. Okay, what is the full form of CDRI? Central Drug Research Institute, which is situated in Lucknow. So this question is very important, that some new method is required, so that what will happen, it will be followed by the people or by the citizen of our country. Fine. So after understanding the reproductive health, after understanding some awareness, facility support, what we can conclude here, we can conclude that after following all these things, our country will become more good in a. After these, we can say that there would be a proper or the good reproductive health of the people, and we have to follow it. So for this session, that much is there, and in the another session we will talk about the population stabilization and what are the different methods to control the birth. Fine. So thank you.